Imagine giving birth to a healthy baby who grows into a healthy toddler and is keeping up with all their milestones, achieving their goals, and is relatively normal. One day you notice small changes in their development and their motor skills. They are no longer keeping up with their friends and they are becoming less and less themselves. Their motor skills and developmental skills have delayed, and things that they could once have mastered are no longer mastered skills. You take them to the doctor to discuss your concerns, and after numerous tests, they are diagnosed with a condition that most people have never heard of. Metachromatic leukodystrophy is a rare, serious, and progressive disorder mainly presenting within the first few years of life. Today we will discuss the signs and symptoms of the disease, prognosis and treatment, and ways to cope with this devastating disease. According to the Mayo Clinic on their website, metachromatic leukodystrophy leads to the destruction of myelin covering the nerves and results in progressive worsening of the brain and nervous system. Around 3,600 people are diagnosed a year with this disease. The Mayo Clinic also states on their website each form of the metachromatic leukodystrophy occurs at a different age and can have different initial signs and symptoms and rates of progression. The most common form of MLD is the late infantile form. This form usually develops before the child is 2 years of age and is the most aggressive form. These experience speech delays and significant loss of gross motor skills that they have already developed. Children who walked will no longer be able to, and rather quickly, and their form of communication becomes severely underdeveloped. These children usually do not survive early childhood in most cases. The juvenile form usually is seen between the ages of 3 and 16. For these children, symptoms do not progress as fast, but they do tend to fall behind of their peers. They do not continue to develop, and these children usually lose the ability to walk. They typically do live for another 20 years after their diagnosis. The adult form is the most rare and develops after the age of 16. This form usually presents with behavioral issues, substance abuse, and this adult may experience periods of psychosis and periods of rapid decline, followed by periods of no decline. The timeline for these patients can be decades to survive. Other signs and symptoms of the disease can be loss of the ability to detect sensations such as pain, heat, touch, and sound, stiff, rigid muscles, poor muscle function, and paralysis, loss of bladder and bowel function, gallbladder problems, blindness, seizures, and hearing loss. These symptoms develop on a case-by-case basis, and treatment plans should be created for each specific patient based on their current signs and symptoms. Due to the rarity of this disease and the limited research available, most treatment plans consist of physical and occupational therapy and the use of supportive care for the management of pain. They can also manage their symptoms through supportive care as symptoms as in they cannot eat, so they will need the placement of a G-tube, or if they have other symptoms that can be managed through supporting the patient. According to the United Leukodystrophy Association on their website, bone marrow therapy is the only current treatment that is known to be effective towards slowing down disease progression. This is not a cure, it is a treatment that needs to be repeated multiple times over the course of this patient's life. There is limited information on a research study being formed in Italy and other countries that involves gene therapy for patients with MLD. Ex vivo gene therapy is a newly discovered way of treating this disease. The American Society of Gene and Cell Therapy states, with early diagnosis, this approach targets the faulty gene. This process is done by first removing the mutated cells. The cells used consist of hematopoietic stem cells. These stem cells are then modified outside of the body and then reintroduced back into the patient's blood without the mutated gene. This process shows promise and could potentially be used to cure a number of genetic disorders. There's not a ton of information about this gene therapy because they do not do this in the United States yet, and is only in about phase 2 or 3 of the clinical trials, so they're not 100% sure the true results and the lasting effects of this therapy, and if the patient would need it again, as the same with the bone marrow transplants, the patient continues to need them after the initial one, so they're unsure if this gene therapy would be the same way. Of course, any parent would be emotionally devastated after receiving this diagnosis for their child, especially if the child is a young age. There are many ways that parents are able to try and cope with this unfortunate news. There are numerous support groups for parents of children with MLD. Hospitals host parent seminars to help parents with children with rare diseases. This helps them understand the illnesses they are facing. Maria Kafelas, writer for Slate.com, writes, "Living with leukodystrophy requires an unforgiving discipline. As the disease takes more and more from you, you must find joy and happiness in what it cannot take." These parents learn to cope with their new normal and take advantage of the small wins and moments of happiness whenever they can. They must be happy that their kid only had 5 seizures today versus the normal 6 or 7. They can be happy that their kid's smiling at the TV when usually they're just in a lot of pain, so they tend to find joy in the small things in life. This is certainly something that no one is prepared to deal with, but finding hope is the best thing that these parents can do. To conclude, metachromatic leukodystrophy is a devastating disease and can be heartbreaking for families. Through learning the overview of the disease, prognosis and treatment, and ways to cope with this devastating diagnosis, we can have a better understanding of this disease. Thank you for watching my speech today, and I hope you learned something.